Hi, and welcome to our page. My name is Yvonne. I am a pelvic floor physical therapist here at HisTherapy, and I'd like to bring you an educational video that focuses on the male pelvic floor. The female pelvic floor gets a lot of popularity and a lot of educational videos, well, because the females get pregnant, we birth the babies, we carry the babies, and that's a lot of trauma to that area. However, men can also have dysfunction. So let's talk a little bit about that. In reviewing the bones, the male and female pelvis is the same when it comes to bony landmarks. We have the two pelvic innominates that at the front lead to the pubic symphysis, and on the bottom have our sits bones. If you turn the pelvis around, we have the lower part of the lumbar spine, the sacrum, and the coccyx. The main differences between the male pelvis and the female pelvis is that the male pelvis is a lot more narrow than the female, for the same reason I gave before, babies. Women have to carry the babies, and so the pelvis has to expand in order for the baby to exit the body. Men don't have to carry babies or birth them, so they don't have to have a wide set pelvis, so they're more narrow. The other thing is stability. Men have a lot more stability, especially in their sacroiliac joints, right here, because again, they don't have to expand or come back together. They are what they are. So men have a more narrow and stable pelvis. If we look in the organs, men and women both have the rectum and the bladder. Men don't have the uterus, so I can take that out. On the inside, what men do have is a prostate. And though you can't see that on this model, it sits right underneath the bladder. If we remove the organs, we all have the same muscles. Looking at it from this angle, we see the deepest, most internal layer of our pelvic floor muscles. Our levator ani muscles, the coccygeus. They're one big, nice sheet, and their main function is support. There are two other layers of muscles, the superficial muscle and the one in between. The superficial muscles are all about supporting those sexual organs, the external sexual organs, bringing vasculature, bringing sensation, supporting them so that both the female and male can reach orgasm. The middle layer is all about some more stability and structure of both the soft tissues and some of the bony landmarks. So here's an image of a transverse cut of the male pelvic floor or the male pelvis. Just to reorient you, this is the back. So this is that sacrum and coccyx, and this is the front. This is that pubic bone, that pubic symphysis. Okay? So let's talk about the main differences between the two. Obviously, the sexual organs. The male penis and the scrotum are both external of the body. The prostate and the seminal vesicles are on the inside of the body. And all of those are the sexual organs of the male. The sperm is created here in the scrotum, travels up through the seminal vesicles and through the prostate, where it creates a fluid that facilitates the trajectory of the sperm through the male urethra and out into the female pelvis for fertilization. During sexual activity, with stimulation, blood flow to the penis helps it become erect. The shaft becomes erect. That is soft tissue. It's not really muscular. However, in order to maintain it and to facilitate its rigidity, at the base of the pelvis is that deep transverse perineal muscle. And that muscle, though small, plays a role in helping maintain that male erection during intercourse. Okay? So the prostate is really important because a lot of men have dysfunction with it. So if we've ever had it removed or we've had radiation to the area, that can all lead to trauma to the prostate itself and the surrounding structures. Anytime you take a scalpel to the soft tissue, it will cause trauma, and there is a high likelihood that it can cause scar tissue that can build up and impair the functions of those muscles, leading to erectile dysfunction or even leakage of urine. Another common dysfunction that men have is coccyx pain, whether they've fallen during a sport or have had another traumatic event like a car accident or something like that. That can injure that coccyx and the sacrum, and that can also lead to a lot of dysfunction and pain and scar tissue that, if not treated, can change the quality of life. So if any of these things kind of ring a bell for you, or if you have any other questions, feel free to give us a call here at HisTherapy, located in Greer, South Carolina. Thank you, and I hope you have a great rest of your day.